So what do we do for menopause? There are lots of different things to do. There are herbs, tons of herbs, and soy is one of them. I'm not really big on soy. I think the problems with soy, first of all, I think the problems with soy, mainly in our country, is that a lot of it is genetically modified. I don't think soy is always bad. I think that it's the process. I'll always say this about anything. It's the process. Even the almond milk. I make my own almond milk. Why? Because you're getting it in this little thing. Everything is pasteurized and deadened to death, so you're not getting anything. So, you know, soy. I think that if you're using the fermented soy, you'd be better off. You know, like the tempeh, that kind of thing. The miso. Not so much soy milk and things that have been really processed. But I believe that about food in general. There are non-bioidentical hormones, Premarin, Prempro, to name just a few. They're bioidentical hormones which can be used transdermally, vaginally. You can use them orally in some cases, subcutaneous injections, or intramuscular injections, all depending on what they are and how you're using them. So we talk a lot, bioidentical, bioidentical, what a buzzword, right? Versus non-bioidentical. So what does that really mean? Well, bioidentical means it is a chemical structure that is identical to what you would make if you were still making your estrogen. Now, non-bioidentical, the structure's similar, but it's not exactly identical. Remember the lock and key that we were talking about. It fits, but it's not the perfect fit. We know that the bioidentical, we know the effects on other tissues is well known. When non-bioidentical, for instance, because we don't have that exact fit, the other effects on the tissues may not be as clearly known. Actually, bioidentical, fewer side effects. Most people stop taking their hormones in general because, at least when I was practicing full-time OBGYN, was because of side effects. Oh, I started that, but I just blah, 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 and stopped. And when the bioidentical, there are no increase in clotting factors unless you're doing oral estrogen. I personally don't prescribe oral estrogen. I think that we have other and better ways of giving estrogen. So when you do that, you bypass the liver and you do not have the clotting factors that are increased, causing a risk of blood clots. And actually, it's beneficial to the heart. We know estrogen and progesterone are both beneficial to the heart, but estrogen and progestin, which is not bioidentical, is probably not good. It negates a lot of the good that the estrogen does. So for a while there was this, should we do estradiol, oral, or transdermal? I think we pretty much agreed now that the best way to do is to try and avoid oral. I personally have a couple of patients who are on oral estrogen because I can't get them off of it. But I would say maybe 1 or 2 patients because of the increase in clotting factors. It also interferes with the testosterone levels. They tend to gain some weight. If anyone, they're more likely to gain some weight. It does increase the triglycerides. It increases gallstones. It increases HDL. And probably breast cancer as well. Okay, but we know this. Increase in triglycerides, gallstones, and HDL, that happens with, this isn't really new. This happens with birth control pills as well. A lot of the same side effects here happens you'll also with oral estrogen get an increase in C-reactive protein, which is a marker of inflammation. That has translated, no one talks about the birth control that everyone gets like candy, but the same effects are very much there. I've not seen any research that says if you have a cycle, you're less likely to develop cancer. That was something I think that most of us have read or has been mentioned, but that really hasn't been the case. When you are in menopause, you no longer have any menstrual cycles. If you are taking or using bioidentical hormones, you can manipulate the hormones so you actually have a cycle. Is it a true cycle? No, of course not. It is a withdrawal from progesterone. Now, some women feel comfortable and want to do that. They feel like they need to have that cycle, which is fine. I don't have a problem with it, so it's really personal preference. Most of my patients, they don't really want to have a cycle. They're occasionally, like one I talked to today, she wants to cycle, so we have her cycling, which means she withdraws from progesterone. Just like when you actually take birth control pills, those dummy sugar pills, whatever you call them, that's a withdrawal from the hormones. It's not a true cycle.